Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, welcome back to Insurance Matchmaking. Welcome to October. As I'm recording this today, it is October 1st. Of course, this is going to air on Saturday, so it will be what are we looking at, Wednesday? The 4th. But we are in the Medicare enrollment season. The annual election period officially starts on the 15th, but we're now able to look at the plans that are available and run some quotes, start doing the comparisons. I've got a lot of my clients have already sent in their information and have me look in their stuff so we can get them taken care of early and get going with that. But I was able this morning to run some checks on some of the plans, just kind of see what's out there. I've noticed there's still some glitches. That's what usually happens on the first. One of the things I noticed when I looked, I'll go with the negative first. One of the things I noticed, and I hadn't caught it in like the first looks we had from the different carriers, but almost every Medicare Advantage plan out there has some sort of deductible on the Part D portion of the drugs. So that's something, if you've been used to not having a deductible on, and you're taking those brand name drugs like Jardiance and Eliquis, Xarelto, Trulicity, all of those, what do we call the tier 3, the preferred brand names. Most plans are going to have a deductible on that tier 3. Now there's a couple plans out there. I say couple because I know one for sure, but there may be others that are doing a deductible on the drugs, but it doesn't apply to tier 1s. Most of them, it doesn't apply to tiers 1 and 2. There are one plan I know of for sure, and there may be others. There's no deductible on tier 3, so they're reserving those deductibles to apply to the non-preferred, the really expensive drugs. So it's kind of like, hey, if we're going to have to pay $20,000 for your drug, you're going to pay $600 before we cover it. And that's extreme because it can be your drug deductible can be, I believe, it's $610 this year. But most of the Advantage plans that are doing deductible, it's usually between $200 and $300. Now, some of them are, or actually, I think I remember I saw $615. I know I was saying $16, but I think $615 is the Part D. I don't know why I said B there. Part D deductible. And like I said, almost all of your Advantage plans are going to have some sort of deductible. Most of them are not going to be that high. The other glitch I noticed, we use a program called Sunfire, and that's where we do our enrolling in the plans. And I did notice, like, the plans that have what they call the givebacks, they pay the Part B premium. And I don't know if it's just because some of that's not set in stone yet because we don't have the Part B premium set yet. It's one of those peeves of mine that the rate will change in January for your Medicare costs. The Part B premium is going to go up. The Part B deductible is going to go up. The Part A deductible, I'm sure, is going to go up. All those things go up. But it's like sometime in November before we actually know what that's going to be, instead of them having those numbers for us when we start the enrollment period here. So that's one of my complaints when it comes to CMS and in the pricing. And if you got a raise in your Social Security this year, which I believe everybody did, you're going to have an increase in your Medicare costs. They follow each other. So it's generally, most of the time, depending on how much you receive on your Social Security, but usually the raise is pretty much eaten up by the increased cost for Medicare. So everybody has that Part B premium, whether you have a zero premium Advantage plan or you don't, or you have a Medicare supplement, you're still going to pay that $185 this year. What is it going to be next year? I don't know, probably closer to $200 or maybe even a little over $200 a month. But the plans, generally what they do is a couple of the plans that kind of base their Part B deductible, the Part B giveback, based on what is this year's Part B premium. So it's going to be very close to this year's Part B premium. So when you do have that increase, it's not going to cover it 100%, but there are some plans out there that will pay almost all of your Part B premium. If you have a Medicare Advantage because you're like, hey, I don't go to the doctor maybe a couple times a year for a checkup, or I don't see any specialists, I don't take any drugs, I don't want to buy a Medicare supplement and pay for that and not use it and pay for a drug plan that I'm not using, I'd rather have one of those zero premium Advantage plans. That's where those Part B giveback plans can be really helpful, because yes, they're going to have higher costs. Your hospital copay is going to be higher. Your maximum out of pocket is going to be higher. But if you're not using the plan, not having to pay your Part B premium comes really handy. And again, it covers your Part D, so you don't have to worry about having a late enrollment if you do add a Part D later. So those giveback plans can be very helpful, and some of them are not real. I say not real generous. I mean, you've got some that are, like I said, $170, $180 a month that they're paying on your Part B, and then other plans are paying $40. So they don't all pay something, and some even have $1 to $4 giveback. We don't call those giveback plans. Some of them do reduce your Part B by a little bit, and that was just because that's how they adjusted their benefits. Because they have to adjust their benefits each year when they put in their bids. Medicare has to say, okay, you're projecting that you will spend 85% of what you take in on your beneficiaries, on your members. Medicare, as you remember, I've probably heard me say, if you're on Medicare, CMS calls you a Medicare beneficiary. It gets a little confusing because when we talk insurance and we say beneficiary, we're thinking about the person that gets the money when we pass away from our life insurance. But Medicare, if you receive Medicare, you're called a Medicare beneficiary. So they have to have those certain benefits. And it was easier. They did it, it's like 2 years now, I think. This would be the third year or maybe it's the second year. But anyway, they put in their bid. Maybe they increase their dental or over-the-counter, or maybe they reduce it a little bit because they're trying to save money because they're hedging their bets on the results of the Inflation Reduction Act, which put that $2,000 cap on the Part D drugs, which this year will be $2,100. But they jiggling their benefits, and CMS goes, you don't have enough benefits there. And so a couple of the companies said, well, okay, we're just going to give everybody a $1 or a $4 or a $3 Part B reduction. And so that was a number that they could project based on how many people they have enrolled. And so they could estimate it based on, hey, everybody's enrolled. We're probably going to gain, 5%, 10% market share on our plans. And so that's going to put our overall spending at this level. And CMS says, okay. And they're repeating it again this year. Just very, very little Part B give back, and it's just to balance out what they're giving out in benefits. That being said, a lot of the other benefits have gone down. A lot of the plans, they're dropping their over-the-counter. Now, when I say dropping, they're not necessarily eliminating it. Some are just dropping it, dropping the dental benefit. So those are all those little things that we need to know when we go to do a review for you, is how important is the over-the-counter benefits, the dental benefits, or is it, hey, what's my doctor copay? What's my maximum out of pocket? Those are more your concerns than the dental or the over-the-counter benefits. So that can really help us decide which plan that's going to fit for you. The other thing is we have a lot of what they call service area reductions. I don't think it hit us that bad here in Tennessee. Some of the agents I hear from that are in some of my Facebook groups, and they're getting hit really hard, that they had one plan was their main plan in their county, because we generally work pretty close to home. We try to spread out, and we can take telesales across the country, across the state, but still the bulk of our business, especially with having a storefront, the bulk of my business is local. And of course, being in Putnam County, that's the greatest population of my clients, or my newer clients, I should say. I still have a lot of clients in Knox County in East Tennessee, but you take that plan out of that county, and that's what you wrote you put everybody in that county on that plan last year, and now that plan doesn't exist. Now we got to find you another plan. The other thing is some of the plans have gone to what we call non-commissionable. So those are not the plan. They don't want us writing those plans, and so that's one of the ways they discourage it. So we try to find a plan that's going to be a good fit for you, where we could still get paid for our time, because you don't pay us, the insurance company pays us. And so if they're not paying commission on a plan, we don't want to write that plan any more than they want us to write that plan. The other thing is, I mentioned that I have that tool called Sunfire that lists the plans that I can enroll people in. The plans that are not commissionable do not show in that platform. So even just to compare, it makes it a little difficult, especially if you have one of those plans, for me to be able to compare your plan to the plans that are available. So some of them, especially like on the Part D plans that have been paying me commission, as long as you stay on that plan, they're still going to pay me commission. So I may not be in a hurry to move you off a plan because most of the plans available are not commissionable, but I'm still going to do what's right by you. The other thing I mentioned recently that we do have 2 zero premium Part D drug plans, and so the carrier that hadn't been it's a non-commissionable, but I'm not getting commission on the other one, but I still recommend that plan for a lot of folks just because they take 1 or 2 generics or they don't take anything at all, but they have a Medicare supplement and they're signing up for a drug plan because they don't want to have that late enrollment penalty. I will probably be moving more of them to this other company. I'm not going to mention the name here on air, but the one that's been a zero that really cut us off at the knees last year, if I can move people that don't cost them any money to another plan, gee, why would I want to do that? I'm not getting paid anyway. So, but the other one is I am contracted with the other company. I can enroll you on their plan through theirs. And with that way, I will still be your agent of record versus recommending you do the other plan and sign up directly with the company or through Medicare.gov. I'm not your agent. I cannot work on your benefit, contact the carrier with questions that you may have about that plan. I can answer general questions, but I can't get specific because I'm not your agent for that plan. For this other one, if I do enroll you on that plan, I will be your agent. I just won't get paid for it. So it can benefit both of us a little bit that I put you on that plan just to make sure. And again, I'm not going to put you on that plan. I'm not going to put somebody on a zero plan just because they don't want to pay a monthly premium, because it really makes a difference on what your prescriptions you have. Now, last year I mentioned I put a lot of people on a $95 plan because it, in the long run, cost them less money than if they went on a less expensive plan because the drug costs were so much more. So, and that's still going to be kind of the case, but I'm also looking at, you've heard me, if you listen here regular, you've heard me talk about the Canadian Med Store. I'm trying to encourage a lot more people to look at that because they have many of the typical Tier 3 brand name drugs that you can get basically for $50 a month. You're going to order a 3-month supply, but you're not going to come up with a deductible and have to pay the first $600. Several of the brand names like Eliquis, Xarelto, Jardiance, when we get this through the foreign pharmacy, they actually have generics. There's not a generic available here, but there is overseas. And if you really need the brand name, you can still get the brand name, but it is going to be more. It's going to be like, I think one of them I saw was like about $80 a month. And that could still be less than what you're paying through your insurance company. The other thing I've mentioned also, and not just for Medicare folks, but your doctor wants you to take what they call, those GLP-1s. We're seeing a lot of commercials for those for weight loss. Health insurance, all health insurance and Medicare do not cover those drugs for weight loss. They will cover it if you're diagnosed with diabetes, and I think, and I'm not positive on this because again, this is a little bit out of my specialty, is you have to have been already prescribed another diabetes drug before you go to those. So it's like you're going to have to get prior authorization on this. So looks like we're up on the break here, and I'll be right back here after these commercials.
Tri-Lite, the people who bring you better internet, are now bringing you better wireless. Introducing Tri-Lite Mobile, a new wireless service for our area. Enjoy nationwide coverage, the freedom to bring your own device, and budget-friendly plans, all backed by the local team you know and trust. Right now, when you sign up or upgrade your internet service, you'll get your first line free. Ask about Tri-Lite Mobile today. Call 833-847-0824 or visit trilite.net. Some restrictions may apply.
Mark your calendar. Friday, October 31st is the 29th Annual Cooking on the Square, presented by the Willow Point Group, Baird Private Wealth Management. This event is filled with delicious Cajun food, sweet treats, handmade pottery bowls, and this year a Halloween costume contest. Don't forget, every ticket helps Habitat for Humanity build homes for local families in need. General admission tickets are $30 in advance, or for $40 you can grab a golden ticket and skip the line. Tickets are available at local banks, the Habitat office, Habitat Restore, or online at uchabitat.org.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, there, just before the break, I was talking about using the Canadian Med Store for some of those brand names and for those GLP-1 drugs. Also, the other thing I want to mention, if you go to my main website, which there is, if you go to the Insurance Matchmaking website, there is a link to my webpage. It's just mattlibbyinsurance.com. And you can click on the about us or the shopping page. It's going to take you to, or contact. It's going to say, click link here to work. It says, work with Matt. And you click on it, and it's going to take you to my calendar. And so when you go to that calendar page, there's a couple different options on there. I will be offering Saturday. I want to start to say Saturday morning, but and that's probably the better way to say it. Is I'm not working, I'm not putting in for a full day, and it still could turn into it, but not scheduling appointments quite as late in the afternoon as I do during the week. And I do, ask people, if you can, make your appointments during the week in kind of just, the Saturday, if you just can't, you can't do anything else. But, sometimes I run into that, maybe one spouse is still working and they both want to come, and maybe it's an out-of-town thing, so it's easier to come on a Saturday. So I'm going to run those Saturday appointments. I'm not starting the Saturday appointments until the 18th of this month, just because I can't enroll you anyway. So I'm not going to take up my Saturdays just yet. But once we hit the 15th of October, it's 6 days a week for me. I did block out the Saturday, November 8th. That is the Veterans Day, where most of the Veterans Day events will be happening on that Saturday. Veterans Day, of course, being November 11th. I usually end up working that day. Because of it's the dual enrollment. Then I'm doing the Medicare AEP, and we're doing the ACA Affordable Care Act Marketplace. Open enrollment starts on November 1st. November is a very busy month for me. It doesn't mean I won't participate in some of the veterans events. Sometimes there's usually a ceremony or whatever on November 11th, and I would leave and go to that. This year, I am planning on going to Clarksville on the 8th for the Veterans Day parade there, because my grandson will be marching with his junior ROTC unit in that parade. So kind of got to go and do that. So I won't be here for the parade here which is also on the 8th, but I encourage everyone to get out and support all our veterans for Veterans Day coming up in November. So that's one Saturday that I don't have a Saturday date open. And I've also put on there, if you're doing the ACA Marketplace applications, you want help with that. If you want to book a Saturday, I'm asking everybody to wait and I can't remember where the Saturdays fall, but wait until after November 15th to schedule those, because we still have a full month from there to December 15th to get your enrollment done for January 1st. The Medicare, that ends on December 7th. So I want to try to get as much my Medicare done as I can, because we do still have another month of ACA open enrollment. So if you already have an ACA plan, but you just want to update, worst case scenario, if you do it after December 15th, you're changing your plan for February 1st, and you probably will just be re-enrolled into the plan you have for January 1st. So you have a little more time. And those generally go a little quicker than the Medicare. There's, as I say, there's not as many moving parts. With Medicare, we've got several different drug plan options. We have several, are you doing a Medicare supplement or a Medicare Advantage? And so there's a lot of things to work out with the Medicare people. The ACA plans are pretty straightforward. It's like, hey, are we doing bronze, silver, or gold? Are we doing, in our area here, are we doing Blue Cross or Ambetter? I mean, that's the choices. So it's not as time consuming to figure out which plan we need to get. So I do ask if you're wanting for the ACA, and you're fine, you can schedule an appointment before November 15th, but save the Saturdays until then for the Medicare, if you would. That's just something I'm asking as a favor. Please send me your referrals. If you haven't worked with me before, check us out. We'd love to help you. I do have Elijah also helping with me. Bree, who's moved on to another job, she's still going to be working, helping her current clients and hopefully signing some new clients here during the enrollment time. So she's going to be available generally. I'm not sure how much she's going to work weekends, but some in the evenings. Just you can call or email, call the office, and we can reach out and send forward a message to her. So she's still going to be helping out. And then, of course, Kalia, hopefully, she's going to work when she can. And if you follow us and know her situation, she hasn't been able to be available a lot, but she's doing as much as she can. So we do have several people to help you. And if you call in, I mean, Amy's not an agent, but she's been doing pretty good kind of figuring out answers to some questions that are common questions. So, and even if she can't answer the question, go ahead and ask. When you call in, ask if you have a question about something. Just tell Amy what your question is. She may, I may be with a client, or I may not be in the office, but she can forward that question to me a lot of times, and I can send it back to her and say, "Oh yeah, here, call them back and tell them this is the answer." And you get your answer. You don't always have to have me. I know a lot of people say, "Hey, I know it's my name over the door, but I'm not the only one that can help you." So, utilize everybody I got in the office. The other thing I kind of wanted to talk about, I mentioned, on the calendar. If you look on the instructions, depending on which appointment you're going, especially Medicare right now, because that's kind of our focus, we use a program called Retire Flow, and that's just what they named it. But it's a great tool for me, for folks to fill that out. One of the things is I have to have that. CMS requires me to have the scope of appointment. Sometimes you'll see me abbreviate that SOA, but I have to have that 48 hours prior to conducting an appointment, especially if you're wanting me to just, use Google Meet or call you on the phone and go or review your stuff. I have to have that form before I can present that to you. The other thing is, but the first part of that form asks for, it's going to ask your personal information, name, address, phone number, email, and date of birth. And then it's going to ask you to list your prescriptions. So you go to your, or pick your pharmacy. And I've had some people say, my pharmacy's not coming up because they're using a, hometown pharmacy, and for whatever reason, it's not in the database. And then they say, well, it won't let me go for it. Pick a chain pharmacy that you would use, whether it's Kroger, Food City, Walgreens, CVS, Publix, any of those major national chains, if that would be kind of like your second choice. And then you can put in the remarks. There is a little remarks section. You can add some notes. So you can put in your remarks, hey, I picked CVS for my pharmacy, but I really use Sam's Corner Pharmacy. And I say Sam as like not Sam's Club, but just, Bill's, okay? Bill's Corner Pharmacy, Sunset Pharmacy. If that's your local pharmacy, put that in the comments. The other thing that would really help me in that comments is if you're comfortable with or tell me which plan you have now, whether it's a Medicare Supplement Plan G or N or F, or a Medicare Advantage. List what that is. Or if you feel comfortable, go ahead and give me that, what they call the MBI, your Medicare Beneficiary Identifier, your Medicare number. Because I can put that number into that tool I mentioned earlier, Sunfire, and it'll show me exactly which plan you have. And that way I can do a good comparison to what you have versus what might be a good, fit to fill some gaps for you that aren't being filled by that plan. So those are some things to help on that. And then it also will ask your doctors. It asks about preferred hospital. That's not as big a deal for me as it is in some areas. Around here, pretty much every hospital takes all the Medicare Advantage plans. That isn't a big deal. I do have one plan, and again, it's not available here yet in Putnam County, and the reason it is because it's not in network with Cookeville Regional, but most of all the other plans are going to be. So generally, your hospital is not going to be a major factor. Actually, probably what means more to me is if you want University of Tennessee or Vanderbilt, in addition to your local hospital, that's probably more key for what I'm needing to know to help you. But what the doctors you see, and you list your primary doctor first, and I think it may even ask you who's your primary doctor, and you mark that, and then it says other doctors or specialists. Put those in. You can put your dentist in if you like. Sometimes the search tool will let you add the dentist. Sometimes they don't. Optometrists and dentists, sometimes their names are not going to come up when you're trying to search. And again, that's something you can put in the remarks that say, I see Dr. Smith for, my eye care. And so we can do that. So those are some things you can help me out on that. But there's a link for that Retire Flow in the instructions. So if you go to the calendar and you look at the review and enroll in Medicare plans. I used to have it say Medicare Enrollment, and a lot of people already got Medicare. They weren't understanding that was the appointment to enroll in a new Medicare plan. But also it worked for someone if they were brand new to Medicare, they were getting ready to enroll in Medicare. That was the same calendar. And then I had some people picking the healthcare enrollment when they were Medicare. And so they were thinking, I need to sign up for my healthcare plan. Well, if you're on Medicare, yes, it's your healthcare plan, but when it says healthcare on my calendar, that's for the under 65 healthcare, not Medicare healthcare, because the forms are different. I have 2 different forms for that one. That there is the CMS does, again, Centers for Medicare and Medicaid Services. I have to have a consent form to help you with your ACA plans. Now, they say if you signed one last year, I don't necessarily have to have a new form because you haven't written to rescind that. But I ask everybody just to go ahead and update that anyway. Even if we helped you out of our office last year, go ahead and sign a new one for this year. The form's the same. It's just, the date will be updated. And so we just show that that's still current. So I really need that. And again, that's not something I have to have before the appointment. It's nice to have it already on hand. But if you're coming into the office again, you can sign a paper copy. We like to have the one signed online because we don't ever have to print it. We just save it as a file on the computer versus having to sign it physically and then scan it and then upload it. So if you can do it online, that helps. And then the other is the client information form. It's a Google document that just asks all your information. One of the things I've ran into on that is people will mark that, will list any doctors or prescriptions that need to be covered, and they'll mark primary doctor and prescriptions. It's like, no, we're asking who those doctors are, what those prescriptions are. We know you want your doctor, your prescriptions covered. We want to know what the specifics are. So it looks like I'm running out of time here. I thought I was going to talk about a couple other things, but it is October. We're doing Medicare, and remember, at Matt Libby Insurance, we can cover you head to toe. It doesn't have to cost you an arm and a leg, and we'll talk to you next week on Insurance Matchmaking. Don't forget to go to insurancematchmaking.com to ask any questions you have for us, and talk to you soon.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.